This is a story of a nurse who did something beyond imagination. When we say the word nurse, it immediately tells us a person who cares. But here in this story, it is opposite. Let's move on to the flashback of the story. Year 2018, month December. Place Phoenix, Arizona. Sutherland was a nurse working at Hacienda Healthcare Facility, which is a skilled nursing facility since 2012. He used to work night shifts. Among all other residents, there was a 29-year-old female resident who was in vegetative state since age 3. So let's understand first what is a vegetative state. People in a vegetative state cannot do things that require thought or conscious intention. They cannot speak, follow commands, move their limbs purposefully, or move to avoid a painful stimulus. It may look like they are awake, but they don't have an awareness of their surrounding. The cause can be past history of brain injury. So this patient in this story was living at Hacienda for the last 26 years. Everything was just normal until one night. Let's move on to the crime scene. One of the healthcare workers goes to change this female patient's diaper and finds the baby's head coming out of the birth canal. She gets shocked and immediately calls the nurse on duty, and they call 911. Nobody at the Hacienda, including the assigned doctor, was aware that the patient was even pregnant. This was the case of sexual assault, and as part of the police investigation, compulsory DNA tests were conducted on male staff at the facility, revealing Nathan Sutherland, a Christian and father of 4, to be the accuser, the sexual abuser, or the rapist. He was immediately fired, and later investigators arrested him, and he was convicted in court of sexual assault and given a 10-year jail term. According to the medical records sent to the Arizona court, the doctor who did the yearly exam on this patient, it was documented that there was no major changes in her health. So a legal action was also taken against the doctor. Sutherland blamed being sexually assaulted at an orphanage and neglected by his mother. So he said that all caused him to act inappropriately and commit the evil act. There is no evidence if this actually happened or he was using this statement to just lessen his punishment. So let's move on to the final analysis. Due to the mention of his childhood abuse, I think he may have underlying antisocial personality, which can be due to genetics and traumatic childhood experiences, such as child abuse and neglect are thought to play a role. An antisocial personality does not mean that they don't like people. Actually, they are totally opposite. These people con others by using their intelligence, charm, or charisma to manipulate others. Let's talk about proposed diagnostic criteria. Moderate or greater impairment in personality functioning, manifested by characteristic difficulties in 2 or more of the following 4 areas. First, identity. Egocentrism, excessive interest in oneself, and concern for one's own welfare or advantage. Sutherland was more interested in his own happiness or pleasure and had the feelings of being powerful due to vegetative state of that female patient. Second, self-direction. Goal setting based on personal gratification. In this case, he had the set goal that he has to target that patient. So this statement is also right in this case. Third, a lack of concern or feelings, needs or suffering of others. Lack of remorse after hurting or mistreating another person. Sutherland conducted sexual assault, and that justifies the statement. Next, we're also going to talk about some of the pathological personality traits in antisocial personality. First of all, manipulativeness, fraudulence to control others. Second, callousness, means lack of concern for feelings or problems. Third, deceitfulness, means dishonesty. Fourth, hostility, means persistent and frequent angry feelings, anger or irritability in response to minor slights or insults. Fifth, risk-taking behavior, engagement in dangerous and risky acts. Sixth, impulsivity, means acting on a momentarily basis without a plan. And last, irresponsibility, means lack of follow-through or the promises. For antisocial personality, the individual should be at least 18 years of age. Please remember, this is just my theory and discussion is based on the speculation and not the verified facts. Thank you so much for joining me in this discussion. This is my genuine intention to educate and promote understanding, but always rely on verified facts. Stay tuned for more content, and until next time, take care of your mental health and those around you. Bye-bye.